Hi, I'm Dr. Rhonda Johnson. Today is Thursday, December 19th, 2024, and I'm doing a bird flu update. Well, the CDC confirmed the nation's first severe human case of bird flu, otherwise known as H5N1. It occurred in a Louisiana man who's 65. He has underlying health conditions and is believed to have contracted the virus from dead and infected birds in his backyard. He currently is hospitalized in critical condition. Now, so far, there have been 61 human cases here in the United States since April, across 8 states, primarily among individuals who have direct exposure to infected animals. Now, most cases have been mild, and there is no evidence of human-to-human transmission at this time. So what are the symptoms? Well, the virus can cause pink eye, fever, fatigue, cough, muscle aches, sore throat, nausea, vomiting, and diarrhea. The virus can cause severe illness as well as pneumonia, acute respiratory distress, sepsis, brain swelling, and even death. Now, animal infections, it's had a major impact on livestock here in the United States, particularly dairy cow herds and commercial poultry. So what has been the public health response to this situation? Well, the state of California, Governor Newsom declared an emergency just yesterday. This will allow that state to do more efforts to control the virus's spread among livestock and prevent, hopefully, further human cases. Now, the CDC continues to recommend that the risk to the general public is low, but advises people who work in the livestock industry or who have contact with dead birds to exercise caution. They are doing testing among livestock workers. However, it is widely believed by some public health experts that infections may be going undetected. Now, the CDC does recommend that the public avoid contact with sick or dead birds, that we refrain from consuming raw or unpasteurized dairy products or milk, that we cook eggs, poultry, and beef well done, and that we adhere to proper hygiene practices after handling food products such as eggs or raw meat. So wash your hands well and disinfect the surfaces. So what about a vaccine? Our government does have an H5N1 vaccine, but it's being stockpiled and it's not in use. Now, keep in mind that this virus is not new. The H5N1 influenza avian virus began infecting humans about 20 years ago, primarily causing pneumonia and respiratory failure. It carried a lethality of 50% in other countries, but so far there have been no known deaths in the United States. Everyone is concerned that it can spark a human pandemic. Theoretically, yes, it's possible because any virus can mutate and recombine, and this one has already jumped species. But remember, this is not 2020. We have vaccines, we have antivirals, and we have wastewater surveillance. So just stay calm, stay informed, and adhere to the public health practices that have been recommended. And I'll be doing updates on a periodic basis. Folks, be well. Take care.